Hi everyone, and thank you for having me here today. Today I'll be talking to you about clinical applications of 3D printing and 3D printing in hospitals. These are my disclosures. Before I get started, I just want to give you a quick overview of my healthcare system and lab. Montefiore Health System consists of 11 hospitals in the Bronx and Westchester counties in New York, as well as a primary and specialty care network of more than 180 locations across Westchester County. The University Hospital is an academic medical center and the primary teaching hospital of the Albert Einstein College of Medicine. Centrally located at the main Montefiore campus, the Department of Radiology's 3D Imaging Lab is dedicated to provide 3D image visualization and 3D modeling, including augmented reality, virtual reality, and 3D printing in support of patient care, research, and education. Here are some examples of the work that we do. For example, we use 3D visualizations, 3D segmentations, quantitative image analysis, 3D printing in AR, VR, and simulation and training. As compared to visualizing images in 2D stacks, as shown here, 3D imaging is much more powerful. And 3D printing and having a physical handheld model really brings it to the next level. There are many applications of 3D printing in medicine, including preoperative planning and intraoperative guidance. We can use models for trainee and patient education. We can use them to perform virtual surgical planning, and we can even use 3D printing to create prosthetics and implants. Although 3D printing has only recently been implemented at many hospitals in the US and throughout the world, 3D printing in medicine actually dates back about 20, 30 years. Here you can see on the left an example from Mankiewicz et al., who created 3D models of the skull, and on the right, this group created 3D models of calcaneal fractures to help with management. And a lot of the early applications were in craniomaxillofacial and orthopedic applications. Here's some more recent examples from about 10 years or so ago, and in both of these studies, 3D printed models were used to pre-bend plates and as cutting guides for craniomaxillofacial procedures. Here, in a study by Jamie Levine et al. From 2013, the authors printed models of 3 patients with benign tumors of the mandible and with virtual surgical planning, and printed cutting guides for the fibular reconstruction and insertion of the implant retained dental prosthesis in one operation. Here you can see the osteotomy guides for the fibula, and then we can see the anatomic model of the mandible with the guides on the right here. And this type of preoperative planning really allowed them to minimize operating time while maximizing precision. And the previous studies all outsourced 3D printing, but it's now possible to print in-house. And here's an example of an in-house model that was printed using CJP technology. And similar to a couple of the studies shown previously, the mandible model was used to pre-bend the metal plate. Here's a nice example of reconstructions that are done in-house with 3D printing at the Mayo Clinic. And in this article, the authors reported on their experience with the use of a novel 3D printed fixation tray designed from the virtual surgical planning data for mandibular reconstructions using fibular free flap. And herein, the 3D printing really enabled ex vivo configuration of the fibula segment with the reconstruction bar relative to the native mandibular segments, and allowed for the compiled construct to be transferred to the head and neck for insetting as a precisely configured single unit. In regards to orthopedic applications, here are some examples of acetabular repair. So we print out the pelvic models, and then we use them to size the device here. A couple of just different examples from NYU and from Einstein. For orthopedics at Einstein, I also create a lot of wrist models and scoliosis models to guide the surgical plans. Taking it a step further, metal 3D printing can be used to make orthopedic implants. These are generally not printed in hospitals at this time, but are commonly outsourced to external manufacturers. Another major application of 3D printing in medicine is congenital heart disease. And in this example from Dr. Shijun Yu from Toronto, 3D printed models were printed to facilitate complex repairs for complex congenital heart diseases. On the top right, you can see this was a simulation model printed in a flexible material, and it was a model of a ventricular septal defect, so it allowed for simulation of the closure. And on the bottom right, we have 3D printed models of right ventricular outflow tract obtained in both systole and diastole from a patient with severe pulmonary regurgitation after repair of tetralogy of Fallot. And the fitness of the stent in the outflow tract was tested in both systole and diastole before the procedure. Here's another example of cardiac models printed by Dr. Justin Ryan. From his time at Phoenix Children's Hospital, Dr. Ryan's team created 164 multicolored cardiac models, which were generated for various purposes. And here he showed that time-based metrics such as case length time showed a mean reduction in overall time for 3D printed models as compared to studies that just had imaging and no models. So that was really exciting to see. In a smaller cohort, my group from NYU printed a series of 3D printed congenital heart disease models and showed that these models provided better anatomic delineation and added information that altered this or confirmed the surgical plan. And the final application I want to discuss here is genitourinary applications. And here on the left is one of the first articles on the topic by Silberstein et al., who did a pilot study on 3D printed renal tumor models printed with stereolithography. And you can see the lesions of vasculature have been over-cured in order to highlight those. And he showed good correlation between the printed lesion and the resected lesion here. And then in 2017, I published a study on multicolored kidney tumor models, which we printed on a Stratasys Connex 500 with a kidney in materialized heart print flex material, the lesion, renal artery, renal vein, and collecting system printed with different ratios of cyan and magenta to highlight those pertinent anatomical structures. And for this study, we had the surgeons review the cases before and after looking at the 3D model, and we had them ask questions about the procedure. For example, we asked them what kind of tumor removal they would perform. Would it be partial or radical? Would it be an open or robotic laparoscopic procedure? What approach would they take? Would it be transperitoneal or retroperitoneal? And then what type of clamping, non-selective or complete? And we saw changes in decisions for all the cases, with the highest percentage of changes being trans or retro or clamping. And here I've just highlighted a study that really facilitated, where the 3D printed model really facilitated the surgery. So this was a case where the patient had a kidney that was in an abnormal location in the pelvis, and this patient already had the other kidney removed. So it was really important for the surgeon to preserve as much of that renal parenchyma as possible. And the 3D printed model really facilitated that surgery. Here's another example, and this was a patient with a horseshoe kidney. So during development, the kidneys did not separate properly. So it's one kidney in the shape of a horseshoe, when there was a giant mass shown here on the left on the images, and then in purple here on the computer-aided design model. And again, we printed this in multiple colors on a Connex, using the Connex technology, highlighting that big tumor. And by examining the 3D printed model, pre and intraoperatively, the isthmus was successfully preserved, and the left renal pelvis and bilateral ureters were safely identified and mobilized free from the tumor. The great vessels were skeletonized, and the blood supply of the left moiety was selectively clamped or ligated during the partial nephrectomy, and this allowed for roughly 90% of the normal renal parenchyma to be spared. And here again, you can see the lesion with the resected tumor, and they closely resemble one another. Smaller, cheaper machines within vat photopolymerization and material extrusion, approximately a fifth to a tenth of the cost of previous machines, are really changing the landscape with regards to the availability of on-site hospital manufacturing. And this chart from a white paper put out by Materialize shows the increase in the number of hospitals in the US with centralized 3D printing facilities from 2010 to 2016. And it is expected that this number is much higher now, several years later. And although the number of hospitals with 3D printing facilities is increasing, the 3D printing workflow for medical images is complicated. And here I've just shown the major steps, which include the volumetric radiology exam. So we have a high resolution volumetric data set, typically a CT or an MRI, but it can also be ultrasound, PET, or any other volumetric imaging exam. We do image segmentation where we highlight our regions of interest and convert that to a 3D surface mesh or raster. And then we do post-processing to ensure that it's suitable for printing. So we might need to close holes or invert triangles. And then we select our 3D printer and materials and print our model. And when you start a hospital-based 3D printing lab, there are many things we need to consider. So how are we going to fund it? Where are we going to put it and who's going to run it? What kind of software we're going to use, what types of 3D printing technologies, and then how are we going to document and control the models that we make. Here I've just shown the outline of the space that our 3D printing lab is currently in. So we have an area for 3D image post-processing with a bunch of different workstations, an area for simulations, and here we can also do simulations, computer simulations or simulations on the model. And then we have some smaller technologies in this area. So we have the Nextent 5100, the Ultimaker S5, and the Form 3 here. And then in another dedicated space nearby, we have 2 large industrial printers that need special ventilation. So we have the MJP 2500 and the CJP 660. And here are just some examples of some of the software that we use to create 3D printed models. So special software for diagnostic clinical 3D printed anatomic models, and then other software for 3D visualization, and 3D Slicer and Firevoxel for research applications. There are 7 major 3D printing technologies according to the ASTM, and although all of the printers use the basic additive fabrication methods that involves building each part one layer at a time, they differ based on the types of materials and techniques used. So we have many things to consider in regards to types of technology. So depending on the type of models you want to print and then the price that you want to spend. There are lots of factors to consider. And then in regard to ordering models, once you set everything up, how are you going to communicate with the physician? So at Montefiore, I set up a system for surgeons to be able to order 3D printed anatomic models and 3D printed anatomic guides. And we did this in Epic, which is one of the major systems, electronic medical record systems used in the US at this time. And we did it under an ancillary order. And within PowerScribe, we created a way to dictate the model as if it was an imaging exam. So I've shown our template here with all the information regarding what type of procedure, what type of printer, segmentation, time, etc. And then we have a way to save the images in our PAC system. So we save the segmentation, the CAD modeling, and then pictures of that anatomic model. And documentation is necessary for hospitals in the US to bill with the newly established Category 3 CPT codes. So I'm very excited to say that in July 2019, 4 CPT codes were released by the American Medical Association, 2 for 3D printed anatomic models, 0559T and plus 0560T. For 3D printed anatomic models, and then 2 for 3D printed anatomic guides. So 516T and 52T, 62T. And the first for each is the main part, and the second are add-on parts, which is why they have the plus sign shown here. And these Category 3 codes are temporary and exist for emerging technologies, services, and procedures, and they're created for data collection, assessment, and in certain circumstances for payment of new services and procedures that do not meet the criteria for Category 1 CPT codes, which are permanent codes. They've been evaluated for clinical efficacy, and they get an RVU, a relative value unit, for reimbursement. And just as an example for these Category 3 CPT codes, I've shown a kidney tumor model here where we segmented the cortex, the tumor, the renal artery, the renal vein and collecting system, and then here are their corresponding 3D parts. So a 5-part anatomic model. Here's the final model all put together, and the printed model shown here. So this model in regards to CPT has 5 parts. It would be coded with 0559T1 time for the kidney cortex, which might be considered the main part, and 0560T 4 times for the remaining structures. And here's another example of a craniomaxillofacial case. So we have a mandible model which had the mandible, the mandibular teeth, and the inferior alveolar nerve. And this would be coded using that 559T code once, and then the 0560T code twice. And then we have 2 types of guides. So we have a mandible osteotomy guide, which would be coded once under the 0561T code. And then we have a fibula osteotomy guide, which would be coded using the 0562T code. In conjunction with the 3D printing CPT codes, the Radiological Society of North America 3D Printing Special Interest Group, which I am actively involved in, worked with the American College of Radiology to create a 3D printing registry. The proposed registry will capture case information on clinical 3D printed anatomic models and surgical guides that are requested as part of routine clinical care. The relevant printed models and guides are ordered and constructed for a given clinical circumstance according to each participating institution's routine clinical practice, independent of the registry, and the registry will show widespread usage across the US, demonstrate typical case types per diagnosis, and further document the effort to produce models and the clinical utility of anatomic models and guides. And here I've just put a link for where you can sign up for the registry. I encourage everybody who is doing 3D printing in hospitals to sign up. And I just want to end with this slide of the RSNA 3D Printing Special Interest Group's reimbursement journey. We're currently early in this evidence and registry phase, but really hope that we'll have full reimbursement as Category 1 codes in the US by 2024. And with that, I want to thank you for your attention. Please feel free to email me if you have any questions. Thank you.